Back 8:13 on your Wednesday morning. So June marks Wound Healing Awareness Month in the United States, and the month highlights the resources to support patients and the vital work of wound care specialists. So Dr. Micah Siegel from West Jefferson Medical Center is with us now. Take a closer look at why it is so important. Thanks for being here.
Thanks for having me.
Absolutely. So this is something that would seem like an obvious, and clearly when we talk about it, it's because it isn't. So where do you declare a good starting point for taking care of the wounds properly?
I think the main thing people need to realize is there's some wounds that just aren't going to heal on their own. And, you know, minor cuts and scrapes, those are okay, but chronic wounds, especially if there's an underlying issue like diabetes, they're going to need extra help, and that's where we come into play.
So tell me what happens when you guys come into play, per se, especially in our population where we have so many elderly people and so many diabetic patients too.
So the main thing, you kind of have to treat the underlying issue before you can address the wound. If you don't fix the underlying issue, whether it's a blood flow problem or their diabetes, if their sugar isn't well controlled, you're not going to be able to heal the wound. So we do a full assessment, kind of getting back to the basic groundwork and then build from there.
What does that look like?
It's running a bunch of tests, ultrasounds to look at blood flow, making sure their blood glucose is controlled with their insulin, and it's a multidisciplinary kind of attack on this, working with other providers, their primary care providers, and vascular surgeons and that kind of thing.
Dr. Siegel, what would you say is the up-and-coming technology or treatment process, standard of care, or how it compares to standard of care that we're seeing right now?
I think overall it's mainly to keep infection at bay.
Okay.
And there's a lot of other products that we use for that, but our main kind of sword, I guess you can say, is that we do sharp debridement, and that's where we're cleaning the wounds of debris and getting down to good healthy tissue. And then we have devices that we can put on the wounds, kind of like skin graft type things, to help them heal faster.
How does someone know, and most of the times people, when you're dealing with wounds, you have a caregiver hopefully is advocating for you. So what education do you offer the caregiver that's maybe caring for someone that has a bed wound or something that needs constant watch?
Yeah, I think the main thing is to not wait too long. And so if there's any concern, even if it's a small concern, to bring them in and be assessed, and then that's where the education really starts.
And talk about you know, the difference between the pressure ulcer versus, and you know, maybe something after surgery that isn't healing. Is there a difference?
Yes, it goes back to that baseline of what causes this, the wound to be there. With pressure wounds, obviously the main key is getting the pressure off. And there's lots of techniques and devices we can do to do that. With surgical wounds, that's a whole different approach that we take to help heal those in a different way. But in general, it's a blood flow issue. So we need to make sure there's good blood flow.
Dr. Siegel from West Jeff, thank you so much.
Thank you.
I appreciate it. All right, let's get over to Zach Fradella with our